All good? Got audio?
Yeah.
Sweet. Good morning. COVID update number 3,956. As usual, start out. Number one, thanks to Diamond Embroidery for my fancy new t-shirt. You can get your own. Number one, thank you to all of our frontline workers, those in our healthcare system and first responders, et cetera, et cetera, et cetera. You know who they are. They continue to be successful and they continue to keep us safe. So I'll get more into that. But just a fantastic job that all these people are doing for us. Last week, I just want to touch on our Healthcare Heroes Day from May 1st. Just had an excellent day, and the job that Michael and Kathy and Rhonda did through the High River District Health Foundation to put that all together, banging the pots and pans at 7 o'clock that night, and we were over at the hospital. Warren was banging on his new snare drum out the window of the truck, and fire trucks and everybody else with their sirens going. It was absolutely awesome and quite an emotional thing to watch with a lot of the nurses and stuff outside of the hospital. So very, very cool day, and kudos to Kathy, Rhonda, and Michael for putting that together, because it was very well deserved by all the people that are involved. So current status of where we're at in High River, we are absolutely moving in the right direction. There's no question about it. And current cases in the High River zone, there are 158 active cases as of Dr. Hinshaw's report yesterday, and there are 377 positive cases that have recovered. So definitely moving in the right direction. But with there being 158 active cases in the High River zone, that is very, very good news for us. Our long-term care facilities, that's always the other one that we're keeping a very, very close eye on, and got an update from Neil over at Seasons yesterday. So at Seasons Retirement Community, all 170 residents have been tested and all are negative. That is fantastic news. They've had 160 staff members tested. They have 82 negative results, and they're waiting on the results of 69 others. Again, everything's pointing in the right direction, and they have had 9 staff who tested positive who were removed from the workforce and are isolating at home and recovering. So very, very good work that's happened over at Seasons. When we see these things get into these long-term care facilities, it gets very, very concerning for everybody. So the way they've handled it is absolutely working and keeping the residents safe and the other staff members as well. Medicine Tree Manor, as I mentioned last week, it is off outbreak status. Currently 0 cases in residents or staff. So everything is being handled very, very well over there as well. The one area that we are continuing to monitor and work on, not we, like I'm involved with it, but our staff at the High River Hospital on 2nd floor. There have not been any new cases for 2 weeks, which is excellent news. Current positive case numbers is 11 on 2nd floor. All 60 staff have tested. There was only 1 that tested positive. So very, very good news. They're doing a great job of containing this thing and not allowing it to spread to healthcare workers up there or anything else. When they see a problem area, they deal with it quickly, and that has been the key component in all of this. And I had my update with Dr. Adam Weiss this morning, and we spoke a lot about the success because of what we've been through, and we are being named the largest outbreak in North America. We got another title. Thanks. But what we have to commend everybody in this community, Cargill workers and the whole community, is to how well you have conducted yourselves and how we're seeing the success of that in the social distancing, in the hand washing, in the making sure you're protected, making sure you're taking care of your family, blah, blah, blah. You've heard it all. And what we are doing is working. And the way our PCN group and Ministry of Health and Alberta Health Services and the cannonball that we did into this town with all the resources a few weeks ago has paid off and continues to pay off. That we're seeing people recover. We're seeing the number of new cases start to decrease, and we're winning. It does not take away from the fact that yes, there have been people that have passed away. There have been people that are still recovering, especially on second floor, and the struggles that not only the person that has COVID, but their families, the struggles that they're going through. It's horrendous, and it's devastating for everybody, and very, very hard to go through. And we can never forget that, but that is also the reason why we cannot start going back into any level of complacency at this time. Get into that in a few minutes, but what our doctors and nurses and healthcare professionals across the board have been very, very good at is, number one, identifying and having symptomatic people come forward, and getting them tested and isolated, and doing contact tracing and finding clusters and getting those clusters contained. That is critical in all of this. And the other piece following that is just the level of connecting and support that our doctors have been providing to the people that are at home isolating, making sure they've got the support mechanisms and all the pieces that are necessary so that they can remain home and isolate. And that is why we have not had big community spread outside of the clusters that I've just went through. So a special note to all the Cargill workers and their families. Yes, I'm scratching my nose, but it's driving me nuts. All the Cargill workers and their families, you have done an absolutely amazing job as to what was asked of you going through this. And you stayed at home, you isolated, you recovered, and we've prevented the community spread outside of primarily the Cargill issue. So massive thanks to all of you for how well you have handled this thing, and you bought into it, you took it seriously, and we thank you for it. It's been amazing to watch. All our long-term care facilities, again, fantastic job keeping things contained and isolated, and keeping it away from residents as much as we have is just absolutely fantastic success. So let me go back into the complacency piece as to where we go from here. And yes, we're seeing things start to level off, but it's leveling off at a peak. So let's not start acting as though this is, I got itches everywhere. Of course, I'm on camera doing this right now. But we cannot go into complacency right now. We've got a few more weeks of being very, very serious about this. And as businesses start to reopen and find their way of how they're going to operate, this is great. We need to start finding our way through the new way of doing things. I'm not going to call it new normal. That drives me nuts, but just a new way of doing things. And it's up to those businesses to conduct their businesses the safest way that they seen fit. Some are going to open. Some have been very vocal about that they're going to remain closed for an extended period of time. And that's just fine. I believe that there's a way we can do this and still provide the freedom of the individual to act responsibly on their own. I think that's extremely important. That being said, with Town of High River facilities, Council has started talking about how we're going to reopen things and when and what that might look like. But we're a ways off. When you look at things like the rec center and is the big one, but we're a ways off of opening that unit. The one we're talking about right now is George Lane Park Campground, not the park, not the playground, but the campground, in opening it to 50% capacity sometime in June. So we will monitor this and see how things are going, but there's areas that we can still provide the social distancing and the safety component to it. And there's areas we can't. So just to let everybody know that it is all under discussion. And but going back to the complacency thing, it's still important to do the social distancing and the hand washing and the don't touch your face like I am right now. It's driving me nuts, but dry skin. Continue to be serious about it. I could go on and on. You've heard me talk about it. Things are not going to get normal until you see vaccines come out. We will slowly transition into a new way of operating, but until a vaccine comes out, we're a ways off of getting back into what was previously known normal, I guess. High River Business roll call. High River Chamber of Commerce is doing a fantastic job of keeping everybody up to date as to what's going on in all the businesses. I've known a big uptake on the businesses on there, sharing their ideas and what they're doing and how they're operating. And it's fantastic. They're doing a great job of getting the word out on that. So for town stuff, with the provincial relaunch, and I noticed there's some comments about my comments, shocker, on social media, but there's certain things I agree with, there's certain things I don't, whatever, that's my stuff. So the businesses have the utmost control as to what's going on within their doors. And they will take that responsibility on their own as how they're going to conduct. The last thing any business wants in this town is to be tagged with, you're an outbreak place. So I do trust the businesses more than anything else to conduct things properly. And, you're seeing a lot of things being said on social media that people are not comfortable yet in just going out, returning to shopping normally. So what they are looking for is watching businesses, if they have the proper protocols in place that provide them safety when they come in there. They'll be there to support, but it's important that the businesses pay very, very close attention to your customers and what they're looking for, because they're the only thing that matters at the end of the day with your business, is your customers. So again, we're not out of the woods yet. We've got another 3 weeks to a month of kind of staying this course, and that's extremely important. So farmers market, food trucks, yard sales, yes, they are all canceled. Opening of the farmers market, food trucks are on hold right now, and we will continue to monitor this, but we're watching to see what happens with our numbers. We're not saying, okay, today's great, so tomorrow will be even better. We want to make sure that things are safe before we start opening a few of these things back up. We do have a live council meeting that is going to be taking place on May 11th at 1 p.m. And you can go to the Town of High River YouTube channel to sit in there and be bored to tears watching us do that. So, but if you're bored to tears, maybe it's exciting for you. Need a hobby. Model airplanes. Something cool. Monster Hobbies down there. Get you a model airplane. High Country Drive, a few construction areas. High Country Drive eastbound lanes are closed as crews prepare for a full closure of the road on May 11th. Two-way traffic is open on the westbound lanes, and this is again to rewind and repair some of those underground services that are in there. Southwest Dike, we are expecting construction to start this week. That everything goes to plan. So you'll see different closures and speed limits and everything else down 12th Avenue. So just be patient. This is an extremely important project, and it's been frustrating long enough. We can get through this piece watching it being built. So there will be some congestion, confusion, delays when we get to the point where we're crossing 12th Avenue, hooking up with the Baker Creek dike. And so access to Baker Creek and everything else, and access out to River Road from 12th onto River Road, it's going to get to be a cluster and everything else, but welcome to construction. It's always a joy. So that's where we're at. Center Street, it continues to move forward on a few issues they're dealing with there, but the project's still online. So, and flood preparedness, you will be able to see a lot more available with flood preparedness. Month of May, emergency preparedness, the sirens are tested a couple times now, so that's all working. Floodgates were tested, that's all working. Southwest berms firing up, so we're ready. So, but stay tuned to highriver.ca. We will be posting river monitoring stuff, and I'll be sharing that kind of stuff on my Facebook page as well. So different areas, and when you're watching the Alberta River reports and their different stations that go upstream into the headwaters, I'll be showing you which ones to primarily keep your eye on as to if you're into watching river levels. But as of right now, everything's normal. Spring runoff, and that's about all I got today, I think. If I forgot anything, wouldn't shock me. My next video. So Michelle and I have been talking, and we're going to kind of gauge this as to whether we do one of these videos next week. Now that things have kind of stabilized and kind of running cruise control right now is what Dr. Weiss and I were talking about, which is good news. And I don't want to do these videos just to do them. There's got to be some information to get out there. There has to be some change. So we'll just gauge this and watch it. Maybe we'll do one next week, but if you don't see one, don't be surprised. We might just do it every couple of weeks from here on. So from there, questions?
Yes. Regarding the provincial relaunch strategy, somebody is asking if the mayor can override what the provincial government is telling us to do.
No, the mayor has zero control over overriding what the provincial government is telling us to do. These are provincial public health orders. There is the municipal control over this is very, very little. So that's what we watch. Is the only control we have is on our facilities. So, and how those will happen. And we're kind of under the guidelines of these provincial health orders as well. So we're watching it same way any business is. So, but no, can I override provincial health orders? Nope. That's it. All good. Rock and roll. Take care. Bye-bye.